Good afternoon. Welcome to the Board of Health meeting of February 3rd, 2025. Please note this meeting is being recorded and will be available shortly hereafter for scheduled and on-demand viewing on any smartphone or tablet. If anyone else is recording this meeting, please notify the chairman. Pursuant to Governor Healy's March 29th, 2023, signing of the Acts of 2023, extending certain COVID-19 measures adopted during the state of emergency, suspending certain provisions of the open meeting law until March 31st, 2025, this meeting of the Chatham Board of Health is being conducted in person and via remote participation. Every effort will be made to ensure that the public can adequately access the proceedings as provided for in the order. A reminder that persons who would like to listen to this meeting while in progress may do so by calling 1-508-945-4410, and the conference ID is 160-996-533#, or they may join the meeting online via Microsoft Teams through the link in the posted agenda. While this is a live broadcast and simulcast on Chatham TV, Channel 8 and 1072, despite our best effort, we may not be able to provide real-time access. We will post a record of this meeting on the town's website as soon as possible. Now I'll turn the meeting over to our chairman, Dr. Noble Hanson.
Thank you. It shall be the policy of this board to conduct its meetings under the open meetings law so as to encourage public participation whenever time permits and as part of agenda item discussions. So we have two things on the agenda for today, but first we'll establish a quorum, and when I call your name, please say present. Carol Boyce.
Here.
John Beckley.
Present.
Dick Edwards.
Present.
Myself, Noble Hanson, present. And then today, Ron Weiser will be a full member. Ron?
Present.
And then our alternate member is Joanna Kale.
Present.
Okay. All righty. So first we have a variance hearing and approval of IA Technology for James and Kristen Savely, 44 Scattery Road, East Southeast LLC, and we have Thad Eldridge here.
And just that is fine. Thad Eldridge, East Southeast, here with the Savely's property. They would like to add a detached garage with a bedroom above. They have a 31,000 and change square foot lot, so we'd be looking at a 4-bedroom total. This would be removal of the septic tank, installation of a denitrifying or IA septic system, and then increasing the capacity of the leach field to make up for the difference. I think it's pretty straightforward, so I'll just ask if there are any questions.
Thank you. Questions or comments from the board? I had one question. So the old septic system is being partly removed and partly reused, the leaching field reused, but explain that.
So the old septic system, it's a chamber system. There are currently 3 chambers, and the proposal would be to add a 4th chamber and then the additional stone to expand it to a 4-bedroom leaching.
That's for the leaching field.
Yes,
And then the tank itself?
it's out of here, and then a new tank would go in, because a standard septic tank does not, it isn't configured correctly for the innovative alternative technology to go
So
into
the
it.
tank is being replaced with the FAST system tank.
In the same location.
Same general location. We won't make them put it exactly in the same spot.
And then there's no other variances other than the extra bedroom for switching to IA?
That would be it.
Yeah. Questions or comments from the board?
Seems pretty straightforward. I don't have any problems with the layout of the house.
Yep.
It's a 4-bedroom house, a 3-bedroom house and 1 bedroom above the garage. It's a 3-car garage?
A 3-car garage, or 2.5, because that last
It's a long
one's
way from the
moved
house.
Yeah,
It is, that's what's striking.
Strange.
It's really, yeah, pretty far away.
there's a lot going on up by the house. We'd have to fully replace the septic if they put something closer, and it'd really take away from the rest of that property.
Now, the flow from the garage to the tank is it pumped up there, or is that downhill?
No, this would be gravity. There is a hill there now, but the idea would be to fill in the property a bit so that the everything pitches downhill. You'll note that we have proposed sleeving the sewer service or the soil pipe as it does cross two water lines.
Okay, it looks pretty straightforward. Other questions or comments? So it's a 31,291 square foot lot, currently 3-bedroom, adding 1 bedroom, going to IA technology from Title V, so to be a 4-bedroom without any other variances.
Thad, what does OHU mean?
Overhead utilities.
Overhead utilities? Okay.
Oh, and those are just out in the street. Everything here is underground once you get onto the property.
Okay, if there aren't, or any other comments from the board, or any comments from the public on this 44 Scattery Road?
I see none.
Okay, maybe can get a motion?
I'll move that we approve this variance with the conditions listed in the memo of 12925 by Judy.
And a second? Okay, and then we can get Judy to read the conditions for the record.
So the standard conditions, the applicant should restrict the property to a maximum of 4 bedrooms and record this restriction on the deed, Barnstable County Registry of Deeds, and submit a copy to the Health Division. The applicant shall sign a covenant with the board agreeing to comply at such time as the town of Chatham, through its Board of Health and/or Board of Water and Sewer Commissioners, directs the connection of this property to the municipal sewer when it becomes available. Throughout its life, the system shall be under an O&M agreement. The O&M agreement shall be for at least 1 year and may be with any mass-certified operator of the appropriate grade that has received training by the company on the operation of the system. Effluent from the system shall be monitored twice per year for the first 2 years, preferably in May and October. The effluent shall be field tested in accordance with Mass DEP standard conditions for secondary treatment units certified for general use, revised March 20th, 2015. In addition, a lab test of the effluent for total nitrogen is to meet this performance standard of 19 milligrams per liter shall be collected and analyzed by a certified lab. Water meter readings are to be provided with the semi-annual report. If any of the field tests or lab tests fail, follow-up tests shall be conducted by a certified lab and an evaluation by the operator within 30 days. After the required 2 years, testing application can be made to the board or their agent for review and possible modification of the monitoring requirements. The applicant agrees to apply a minimum of 6 inches of compacted topsoil to all disturbed areas of the property. The engineer shall submit an engineered as-built plan, including as-built elevations, with a written certification that the system has been installed in accordance with the approved plan. No alteration to the floor plans of the dwellings or the site plan will be allowed without further review by the Board of Health or its agent. And the variance is granted pursuant to the town of Chatham's nitrogen loading regulations and is valid for 1 year from the date of the Board of Health approval. A permit must be issued and work commenced during the 1-year period of the variance shall expire.
Okay, thank you. I think we can probably take a voice vote for this. All in favor of the variance for 44 Scattery Road, say aye.
Aye.
Opposed? All right, that variance is granted.
Thank you so much. Have a great afternoon.
Thank you.
Thank you. Judy, I have a question. In general, when these systems are tested, they do well on the sampling. I mean, has it been our experience that these
They don't do
What do you
it.
mean by testing?
No, they do, they do.
twice annual water quality testing of the
and
effluent?
that testing,
To make
right.
sure that the system is actually delivering.
I mean, sometimes it will vary slightly, they'll go above 19.
They will.
But usually they're somewhere in that 20 to, sometimes much less. I was just looking at one today that was like at 8 milligrams per liter, which is quite low.
That's the testing that they do routinely.
Right.
But the Board of Health, the county health board tested all the IA systems in Chatham a couple of years ago,
They did.
and they didn't meet
Well,
standards
they have,
that the manufacturer said in terms of nitrogen at the effluent.
Okay.
The nitrogen coming out of it was
Was higher?
substantially greater than the manufacturer's specifications. And they postulated, well, maybe they're not being installed properly or there's something. But, you know, the testing that we're ordering is different. The testing that the Board of Health
Is
did
different.
was actually testing the nitrogen coming out of
The effluent.
of the effluent. And the FAST system, which is almost all of our systems,
Okay.
failed.
are you talking about the raw effluent?
The one, the chart that the County Board of Health showed us on our
Yeah, I mean, it.
our systems, and they said that like 75% of them didn't meet the manufacturer's standard.
Of 19 milligrams per liter or below?
Whatever it was the effluent.
I
And
think
the
it would-
ones that did were the expensive ones, and the FAST, virtually all of them did not meet what they were supposed to be doing.
They tend to fluctuate around that 19 above and below. Some are much higher, some are much lower. We do have, 20 years of data.
But we're
I
not
can
testing the effluent, are we? Are we going down and digging down and
Yeah,
testing?
that's what they're testing.
The outflow pipe.
They're testing.
outflow pipe.
Right, the treated effluent from before it goes into the ground, they're treating. They're
That's what we're
testing.
doing twice a year.
Yes.
So why is the Board of Health saying that all the FAST systems failed to meet that standard?
Barnstable County saying that?
County.
Yeah, the woman that came here and gave the talk, and she gave us the handout.
She did a study and
And,
many of
and
them
she
weren't.
said that out of like 30 units we had in Chatham, only like 6 met the standard.
The
And the
discharge.
FAST system, virtually all of them failed in their testing.
Yeah, I don't,
mean, I can get you
think
the-
that's a
the-
misinterpretation of what she was saying. I
Well,
mean,
that's what she said. And
I mean, I can revisit the data and provide it for you, but definitely they were all over the place.
we asked her.
The problem is that, these things are supposed to get a 50% reduction in total nitrogen, but you don't know what number they're starting with, because we're not testing influent. So you could have nitrogen that's, they're assuming 45.
Oh, if I may.
Ooh, yeah, we
The
have that.
assumption that we've had is 35 with all the
They're
low
starting with
flow.
45.
They're doing that now.
I think that's what it was.
Okay,
Well, our
but-
nitrogen loading regulations say 35, I
All of our
believe.
nitrogen loading calculations have always started with 35.
Okay,
But
but
with all
the
of the
influence
low
much
flow
higher.
technology, you're going to have 70 parts per million going into that tank.
Yeah.
So getting from 70 to 19 is difficult for a lot of the systems.
70 would be the typical effluent if there was no
They don't know.
treatment?
We don't know, and it's going to vary. The
the
people who
intake.
take longer showers are going to have less concentration. If you use all the water you're supposed to when you cook pasta, you're going to have more water in there, you're going to have a lower
Yeah,
concentration.
there's so many
of
variables,
So
that's
many
the problem.
variables.
Some of them do quite well, some of them don't do well. It depends on how often they're being used, whether they're seasonal or not.
This is a sampling time of year impact that?
Yeah, well, that's why we say, we want them to do it in the spring and then again in the fall. Because if they're empty half the year, then they have a startup time period that
Yeah.
they need to
There
kind of
was-
start working to their full.
One that I
Judy-
reviewed.
Judy,
Oh, please.
what happens if, on one of the tests, it comes back high?
They're supposed to retest.
What is that?
Retest.
What do they do?
They, they're supposed to
They mean-
try and,
they mean
the operator of the
The operator of
system.
this, okay,
is-
the
They're
contractor.
supposed to try and figure out why certain things are off.
Why it's still high?
Retest 30 days later. I don't
So
know
let
that
me ask-
always happens, but
Let me ask that, have you ever had, as an engineer, ever had to go back and redesign or figure out why levels are high because
No.
of testing?
No, and it's.
no, the operators.
So
do
I
that.
was reviewing one with Mike Moreau of J&R, who resells the microfast systems, the monster system we did down at the Chatham Tides. Oh, sorry, there was one report that was skyrocketed, and it was in the fall, and it was, why did this happen? It was right after they had cleaned. All of the cleaning agents that had gone down the drain killed all of the bugs, and then the nitrogen
It
skyrocketed.
upset the process.
So there's things like that that can happen.
So chemistry is a messy science, and then natural chemistry
Even
is.
messy, even more unpredictable.
Absolutely.
Okay.
Well, maybe we should ask the woman from the Barnstable County Health Department to come back and revisit that, because those data were disturbing. And it may, and maybe it's because the septic systems in a place like Chatham are being used entirely differently than across the country. And there's a lot of people coming, and the houses are overloaded with people, and there's a lot more stuff going into these septic tanks.
And actually, if
than-
you have more people in a house, I would expect you would have a better
Yeah.
rate. If you have one person living in a home, there's too little flow that's gonna drop that
The more they're used,
concentration.
the better they are, because they're,
Really?
There's not much nitrogen going into the system if there's only one person.
But is there
Well,
as much water going
it's
into the system?
concentrated in,
Well, maybe it'd be interesting to get.
let me look
that
at the
study,
data, you know, we can put
because-
this on a
She
future
gave us a
agenda,
table,
that's,
and the microfast looked really bad in that table. And
Yeah, well, it'd be
And-
nice to know whether this is all just to make us feel good, or whether there's a genuine,
but again, if you're getting
Improvement.
50%, if you're starting at 70 or 90, you're still getting
Yeah.
better than a conventional system.
okay.
You know what I'm
So
saying?
there may be the
Yeah.
big picture benefit of doing these systems.
Right.
Regardless of whether you hit
Whether we're actually
19.
getting that number. There are also, you know, we could talk about this on a future agenda, but there are also recommended technologies that the state is trying to work up a list. And once we get that solid list, we can start talking about requiring those instead of these other systems that maybe aren't on that list.
Okay.
So,
And we,
All right.
we reviewed
I have a
this.
quick question. I mean, I don't know about anybody else, but, I mean, I'm no expert on these systems. And we seem to be getting these systems at every meeting. Would it be worthwhile having somebody from the manufacturer come and meet with us and just answer some of these questions?
yeah,
It would be, but that's gonna be a sales presentation. You know, that's not gonna be a scientific presentation.
I agree, but I think you've got some pretty good questions and pretty direct
Well,
way of
there
asking
are
some
the
questions. I'm
consultants who are
sure
under
you get some good
contract in the
answers.
system, that, they must be pretty well known.
We
I
had
don't know
the
if an
ca-
engineer could come in and address some of these questions from your
Well,
perspective.
who is it works for the county health department that oversees
Yeah.
all the, we have all these test systems down there, right?
Emily,
She's the one that came and
yeah.
presented that.
Well,
data.
it'd be good
Pull up the
to review that and see
information.
exactly what that study was and what the data was again, and bring it up and be able to answer questions. And
we
if
can
there's
definitely
somebody
have a
else
revisit of that.
Somebody else can get in that would bring some more expertise.
Yep.
I
And we
don't
could have
remember
somebody
the
from-
exact scope of that study that she did, but I do remember that the FAST system didn't perform as well as the others
And nor did the
in
singular.
that study. But it is less expensive, I guess, so.
It is. It
How
is.
much
And so
difference
commonly
in
used.
price is there in these systems between?
these
the-
systems are gonna be $10,000 to $15,000 on top of a septic, and then as you go up through the systems, it's going to increase. I mean, the-
Significantly, so.
significantly,
the
you could
fast
have a
is
30 to 40.
Significantly less than the other ones.
Okay,
You
so
could
we
have a
will,
$30,000 to $40,000 system, which is the nitro or the nitrex.
Right.
Okay.
And that's what's being proposed. Wellfleet is pushing for all nitro and nitrex, which means,
Exclusively.
and everyone's gonna put in a very expensive system.
okay, so what we probably should do is, let's say we need to put this, make this an agenda item.
Future
And let-
agenda.
A future agenda item, and let Judy put together some kind of a panel. And if you have suggestions about who might talk or whatever, get that information into Judy, and we could maybe try to get a few different people who would talk from different
think-
perspectives, and re-review that study.
Yeah, I was gonna say,
Because
can
what,
we
she
pull up some
didn't
of the
talk
stuff?
about the whole thing, as I recall. She reviewed one study she had done, but probably needs to be an agenda item.
Yes.
Because I think this board ought to understand the principles
Right.
at
And if it's
play.
supposed to be 19, and the fast is 30,
Then
no matter, even if they are putting
19
70 into it, they're not meeting the standard. And,
to
and
discuss
means the
this.
19
might
is-
need
Yeah,
to stop using.
We'll
the
put this
fast
as an agenda item, I think.
Okay.
And the other thing is, the original point there was someone who would come in and talk a little bit about the science of the septic system and the bacteriology and the chemistry and exactly what's happening.
Right.
Because it would be good to get that out.
She tried to
Okay.
keep it simple last time,
Yeah, so, all right, so we'll make an
Okay.
agenda
If I
item,
may,
that's what
there
we're
are
supposed to do.
two factors that we use. I mean, everybody looks at it and says, how can I get through? How can I get my additional bedroom? The Microfast, the Singular, they're not the best performers, but they are on the approved list.
Yeah.
And then, as far as I know, the Microfast is the only one that can go under a driveway and has a H20 wheel loading capacity. The others all have plastic chambers to grade or other items that you can't drive over.
Ah, interesting.
Okay, all right, great, thank you very much.
Hey, thank you.
Thank you.
Okay, so now we have the next on the agenda, this is actually on our agenda, short-term rental update. This will be a general update of the short-term rental regulation. And then there's an issue of fee changes coming up, and Judy is going to address those two aspects, and she's given us some notes here. Judy?
Okay, so, I gave you out just before the meeting, a report from Karen, our housing inspector, just for an update for our new members. You probably know this, but the short-term rental, program started up last God, now I forget. We started registering people last March. We hired an inspector. The regulations were passed last year. We hired an inspector, and she started this fall, and she's been really great.
One of those?
Is this
I
Karen?
didn't get one.
Started in April here.
April,
She started in April?
yeah,
Okay, seems like it was just yesterday.
because she started shortly before the summer.
So, long story short, so far, this past year, we licensed, or we gave out 964 rental certificates, and she's had issues with about 42 properties, where she's had to discuss with them how they were advertising them, what rooms they were using, those types of things, and for the most part, she's been able to get everybody where they need to be, I believe. We haven't had any hearings or anything like that, she's just worked with people.
What again made them non-compliant? Bedroom numbers?
Basements, bedrooms, or more bedrooms than we had them listed for, so they had to change their advertising and their layout of their rooms and such, so.
So does she have a chance to look online at their actual advertisement for bedrooms? She's able to do that?
Yeah, that's what she
Wow,
does.
okay, great.
Yeah, because we asked them for a web listing, and she basically looks at them all, unless it's a pretty simple two-bedroom
It's a
cottage or
wonderful
something.
tool for us.
So you can really see what everybody is doing, and if there's any questions or concerns, she can talk to them and get them to change things, and
How many are listed at the state for Chatham?
she didn't give me that number, but it's somewhere around 1,100 when you take out all the places that we don't cover, like lodging houses and
So there's still
hotels, cottages, all of that.
okay, so
So-
there is still a separation between the number of registrations that homeowners have filed with the state
Yeah,
and the number that.
and then some of those may have discontinued renting for one reason or another. And then she has gone through and sent, I think, everybody that she could find a letter, and she's been following up with those people.
Trying to close that
Trying to
gap.
close that gap, yeah.
It's not as awful as I thought it could be.
No, she's done a really great job. I mean, it was very time-consuming for her to get in touch with everybody and send out letters and
And this is,
sort through the state's list, compared it to our list, and,
and the heaviest lifting is the first year or so, I would think, on
Yeah.
this, until you
yeah,
kind of
yeah.
begin to repeat.
Has she been able to compare the listing with the number of bedrooms allowed by the building, the building certificate or the deed or the assessment? Has she looked at?
Yeah, that's
that?
not always so clear, but yes, we do. We go through the building files, we go through the assessor's records. The assessor's records aren't really, it's kind of like comparing apples and oranges because they have a different, like, if, we might call it a bedroom and they wouldn't, and vice versa, so.
Now,
But like that one next to the Chatham Lighthouse that was advertising 6 bedrooms, including a pool house with a bedroom, that clearly didn't have
Yeah,
a building permit allowed that. That would have been picked up if somebody hadn't complained?
I forget how we.
Somebody complained.
Yeah. I don't know, I don't remember whether we.
I think
picked
there
that
are a
up ahead
lot
of
of these
time.
in Chatham.
After going through that particular house, they took a room out of it was a tough house because it was a very historic house. So there was one room they were using as a bedroom, and,
They had the pool house with a bedroom and a bath in
and
the
the
pool
pool
house.
house was being used as a bedroom. We went in with the building inspector, they agreed to take one of the bedrooms out of the main house, and they got permission from the building inspector to put it in the pool house.
swap it out for the pool house.
So it all worked, we worked with the owner, and that's kind of what we're trying to do, is work with people and get them into compliance. So, the concerns that we're having, the issues are, is like basement rooms that they might not list as a bedroom, but you go in there and they have beds in them, they have bunk beds in them, or they might be calling it a bedroom, and we tell them, you can't use it as a bedroom, but how do you,
So
tell
they're
them?
not advertising as a
They're
bedroom.
not advertising it as a bedroom, but it's got bunk beds in it,
How do you enforce the occupancy limit?
Right.
Is what you're getting at.
yeah, and how do we tell people to remove beds, and so that's something we need to work through.
Like 4 bedrooms, but they sleeps 28.
Well, they can't post them that way anymore, because that's something we really look at. So if it's 4 bedrooms, can only have 10 people.
Right.
But, if they have a pull-out couch and they put that other 2 people on that, that's fine, but if it's in a basement where there's no legal egress, it's not a safe condition.
Yeah.
We don't want them having beds down there, but we also kind of aren't telling people what they can do with furniture, so. So we have to figure out a kind of a standard operating procedure for stuff like that.
We can readdress the issue of parking. If somebody's advertising 3 bedrooms and they have 6 cars parked on the front lawn,
Right.
that's a problem. And if we did have a parking limit for the number of bedrooms, we could control that, because it's easy to drive by at midnight and see how many cars are parked on the lawn.
Yeah, I mean, that that hasn't been,
I know that, there's a house next to us that's it's 3 bedrooms, and sometimes they have 6 cars parked in there.
Have you gone out with your
driveway.
night goggles on?
I don't need night goggles.
Done one of these things,
I don't need night
You
goggles.
just-
But, what it is, it's like that house at the corner of Old Harbor and
Barcliff.
Bar Cliff that was advertising 6 bedrooms, sleeps 20, and it wasn't 20, a family of 20, it was 10 couples, 10 cars.
Yeah. Well, those are issues that are kind of hard to deal with, but we're doing the best we can and trying to figure it out as we go along.
You can't inspect a property when there are renters in there.
We would rather not, I don't think
You
they'll.
could do it at like changeover time, noon on Saturday.
Yeah, and if
you-
we have
you had to address
complaints
it.
and we had to go to the Realtor and say we need to get it, we would work it out, they would work it out for us.
Have there been any of the rental agencies that have been more of a problem than others, or have they all been cooperative in
I
policing?
think for the most part, everybody's been fairly cooperative with,
And what's the ultimate goal in terms of inspection? That every one of these short-term rentals would get inspected?
so, and she's done, so far, she's done 44. What we're trying to do is about 300 a year right now, so in 3 years, we'll get them all inspected at least once.
Okay, that's good.
So,
Does Lucas help with that, or is that just Karen?
she's been doing it,
Lucas is fully.
So what
busy
she
with
did
that.
was she sent out letters to randomly chosen, people. And so far, she said, good, people have been calling back to reschedule, and
So they accept no problem.
Yeah, and a lot of times it's been realtors or property management companies. and
Not
such.
even owners.
Yeah, that have been setting those up, so.
Yep.
So that's worked out well. She did mention here the things that she's looking for, functioning smoke and carbon monoxide alarms on every level of the home within 10 feet of every bedroom. Fire extinguishers, confirmation of hot water, label electrical panels, functioning doors, windows, and locks. Basically, it's just putting an eyeball on the dwelling.
She'll get better and better at this, too.
Yeah, and she just completed in the last part of her report, she just completed, Tier 2 housing training with the state. It's required for, pretty much all health agents now to do these trainings in food and housing, et cetera, and she just completed that. So I think that was a good thing for her. So the other thing I wanted to bring up is we touched on it last week, was that going through the budget process.
Just one other follow-up.
Okay, sorry.
Just for perspective, so as of January 30th, 2025, 964 rental certificate applications submitted. So she started in April of 2024, well after the deadline, and had to catch up for the summer. So to me, this is a dramatic improvement in the system.
Yeah.
Compared to a year ago. This is really
good.
good.
This is coming through.
And then the next step would be, as Dick said, parking, addressing complaints, what we could do to tweak the rules to make compliance better or make it work better.
I think we were really lucky to hire somebody with experience.
She did. She had
I mean,
in
this
Eastham, I
was a
believe she had
great-
experience.
Eastham,
doing
yeah.
short-term
It was
rentals.
a great hire.
Great
And she's
fit.
working full-time at it, so.
Is she
Yeah.
full-time?
She's full-time, yep.
And she's
Just-
dedicated to this
Yes.
topic?
Yep, she's the housing, her official title is housing inspector, but I call her housing inspector / administrator, because she
Now, was Lucas-
she basically administrates the program.
Now, I'll ask you that, now you may be getting to this, and if you are, just tell me to be patient. If you throw a number around her salary, her fringe, her travel, whatever, and you come up with a number, and then you divide that number by how many registrations we have. In other words, you try and figure out what is she costing the town of Chatham?
Yeah. I mean,
And then you look at what's the revenue stream from the 900.
let me do the math.
In other words, how are we doing in terms of costs relating to, are we
We need to
making more
increase
money
the-
on the,
the fee.
are we deficit financing, you know, where are we on?
Yeah, I mean, we haven't made enough to cover her.
Right.
Do we need to
I think
consider
that is the next
increase?
topic. So,
Yeah.
any more questions on the basic review of short-term rental update? Any other?
I think this is pretty good news, though.
Yeah.
Yeah, I think she's doing a great
I
job.
have one
She's-
question. Does Lucas, is he totally busy doing other inspections, or is he available to help her if needed?
He is available, if he's needed. He
Not to get
also
into your
handles
business or
like housing complaints, like outside, like
Sure. Yeah.
not short-term, but people that are renting units, and he covers nuisances. But he doesn't do
Right.
the
So he's-
day-to-day
okay, possibly.
short-term. But if there was something that he certainly would go out with her. And I'd actually like her to start going out with him on some of the other things.
Crisscross it.
To see some of the other issues that we do, where we do have real issues. Because most of these places are gorgeous,
Okay, good.
She's always like, oh.
So,
All right, so-
are we close to covering her, or are we, I mean, would a modest increase?
Okay, all right, that's the next topic. So
Yeah,
short-term
no,
rental update.
we're barely covering her, no, we're not covering her salary. We're maybe half, or maybe three-quarters of it.
Yeah, so now we can move on to the fees, the short-term rental fee that Judy's going to explain, and that gets into the whole thing of what her cost is and what we originally did and what might be happening.
Well, right now, it's $50 for registration, and the idea was to keep it low, and then they last 2 years ago, whenever they put the money in the budget to hire her, and then they still wanted, it wasn't really quite enough to cover her salary, but what you probably saw for the next fiscal year is a position, through community development, the building department, for a housing, inspector. So the, Massachusetts building code that just went into effect, or I think they might have pushed it out a month or two, but it's going into effect, is, now states that every short-term rental has to be inspected once a year by a building inspector.
Oh, boy.
So, and that's different. Karen can't qualify as a building inspector. That's a state certification. You need to be a builder or contractor with certain, number of hours.
And who has mandated this?
The state.
The state, that every short-term rental must be inspected by a building inspector.
Right.
So that's a
Once
whole
year.
new thing.
I'm not, it's an unfunded mandate, basically, so,
So the state's not giving a nickel.
no.
Towards
So, Katie and Greg and I and Karen, our housing, we all sat down and talked about how we could do this, and so they've put in the budget to hire someone.
Who's the
and
they?
they're-
Who's
The
they?
building department, the community development, and, they're also, as, part of asking for the money in the budget, they're saying that we're gonna increase the rental fee, registration fee, and they said $100.
Increase it 100 or up to 100?
I believe it was increase it $100.
I don't like this.
Obviously, I mean, at this point, we have to have it in the budget for the discussion, so the finance committee and the selectmen and all of that can review it and agree or not agree whether we're gonna move forward with it. But the fees can't be changed. That's a regulation by the Board of Health, which we have to, have a hearing and discuss any changes to the regulations,
So if the town increases the fee for the short-term rental,
Well, they're not gonna increase it. They're gonna either say yes or no, that they're gonna move forward with funding for this position. And with the understanding that we would move forward with, increasing fees to help cover it.
but that increasing fee would have to come through the Board of Health and be approved by us?
Yeah, because it's in our regulation.
Okay.
And,
Or the town could fund it, the town, the select board could come up with money.
Yeah.
The bottom line is, if they don't fund a housing inspector, then we have to shut down all the short-term rentals in Chatham. And I don't think the select board is gonna go for
I
that.
don't know if the state is,
Well,
how heavy.
well, if that's the mandate,
on this, but,
If it has to be inspected and it can't be inspected,
so they need an inspector, and our thought is that the inspector and Karen will work together. Because they're gonna be looking at different things. And it would be teamwork and.
Wouldn't make more sense to consolidate the program into one department, i.e. the health department?
We're not building inspectors, and she's not a builder, so, it
That's an
has-
official title, building inspector is I guess, a certified position.
So
But
they want
Julie,
us-
let me ask you one question. The building inspector's rules about what is a bedroom, the short-term rental is predicated on what is a
They don't
bedroom.
have
And
a
the
rule.
health department's criteria for what is a bedroom, my understanding is they're not the same.
They don't really have a rule. I mean, they're not gonna be looking at number of bedrooms. They're gonna be looking
So the
at
inspections-
structural, fire, safety, those types of
So the
things.
inspections being done by a building inspector aren't gonna help you with your inspections of the
This
short-term
is
rental
bad, because this
bedrooms.
silos this into different places.
Well, that's why we want them to work together, so,
If we
it
have-
would have to be done as a team.
Would they consolidate their criteria? Do you think that would happen, or no? The criteria for bedroom by the building department and the health department.
They don't look at bedrooms. The
They don't look
My
at bedrooms.
point is,
They look at egress, they're gonna look at, well, if this is being used as a bedroom, you have to have
but
a.
if the health department has a need to validate the bedrooms, and we've got an inspector from the town in a different department going through every one of these every year, then there ought to be a mechanism for us to have that building inspector look at that as part of their other checklist
Yeah, I
to
mean,
help us.
that, and I'm not saying that won't happen, but they don't, you know, we're gonna have to come up with a protocol on how this is gonna work. This is all in the very early stages.
Now, is the building department going to expect that the cost of their inspector be defrayed by revenue from our program? Or
That's
is
the idea,
town
but
of
the money
Chatham-
all goes into the general fund, so
I know.
we don't want to have them have to pay two fees, one for the building and one for the health. That seems silly, so it would make more sense to have one fee that would cover the whole program, so.
But if you've already got one person and they're charging a fee of $50.
Right.
And now you're having a building inspector, and let's say he's paid $100,000. Just doing the math, that comes out to about $100 per rental unit,
Just for them,
for a rental unit. So are we now going to charge the rentals?
150?
What they said,
150?
increase $100 to
I
one.
mean, I don't think this is set in stone yet.
Yeah.
I don't, maybe Greg has been in on some of these discussions, he's on the line.
But it,
Maybe he can answer some of these questions better. Greg, you want to help me out here?
Yeah, sure, happy to. So with what's been going on so far, the conversation has been that, you know, it is an unfunded mandate from the state, and every short-term rental has to be inspected on an annual basis. So that is, you know, a ballpark 1,000 inspections per year. It's going to be very difficult for even one person to do that. I
so,
think,
excuse me,
you know,
so the state's mandating this building inspector inspect the short-term rental every year?
Yes.
every rental, every year.
Eric, okay. Now, is that
So
set in stone now? That's been passed, that's done? That's a done deal, that state mandate? As far as you know?
yes,
Yeah.
as far as I know, that is the state mandate that has already been passed. Not saying that it won't get repealed, called back for some other reason, but that's what we're going with right now.
All right, thanks. Sorry to interrupt.
Sure, not a problem. So the building inspectors, the potential new hire would be pretty much all out doing 1,000 a year. And they would be doing the things required in the building code, whereas our health inspector, one would be providing a lot of the scheduling and assistance, looking at the bedrooms, making sure the program was working, but it not necessarily going out to every single property every single year. I think she had already planned on attending maybe a third of them every year. And I think the ballparks that have been talked about so far are potentially raising it from a $50 fee to a $150 fee. I did run a few numbers while you folks were talking. It looks like, I think Judy's pretty close, maybe about 75% of our current employees' salary is covered by the fee of the permits. So 150 may cover most of both of them, hopefully, depending on health insurance and a variety of other aspects. And I'm trying to think what some of the other questions were. One was, you know, why does it have to be in community development? Why not keep it in one? They have the building inspectors over there. They oversee the building inspectors. They have that experience. Really, it should be placed in that portion to be able to coordinate with the other building inspectors. That said, you know, we have in our health division a very, you know, clear regulatory requirements to look at number of bedrooms and a variety of other things. And there are inspections going on right now, and it's not just, you know, Karen, it's not just health, but they're inspected for fire, they're inspected for a variety of other things. So we do try to coordinate, and I think that's a lot of what our health division is going to be doing, trying to do the scheduling, coordinating, and making sure that, you know, one, it's the most cost-effective for the town and for the applicant, and two, not that, you know, a homeowner would have to require, you know, 3 separate inspections. Hopefully we'll
Yes.
try to coordinate that.
Right. If you've got a member of the, if you've got a town employee physically traveling in a car to a place to get out of the car and do an inspection, they should be doing a comprehensive inspection at that time, not a silo inspection that just is, responsive to the one issue that they're. So when I look at this memo summarizing what Karen is focusing in on as part of her inspections, it would seem to me that a building code inspector would look for every one of these items.
Except the number of bedrooms.
Except the number of bedrooms.
Yeah.
Exactly. So if there is a need to tweak the scope of the building code inspectors' inspections, and it may require one additional thing for him or her to look at, it's a hell of a lot more efficient having that be done as part of their inspection than having one of a health inspectors worrying about it. You know what I'm saying? In other words, just,
Yeah.
it,
Yeah, I mean,
Well, I think what happens is when we go out and if we see issues in any of these areas and, because we're not the experts, we would refer them to other inspectors. Like, okay, I don't think you have the right type of carbon monoxide detectors. You're supposed to have them on every level. We'll refer you to our fire inspector, and those types of things. So I think like Greg said, for the 300 or so we try and get in every year, we certainly would work with the building department and do team inspections. And we do that now with them, so for
why would we
businesses.
even have to go into 300 units a year?
If the
If there's-
building
if
inspector
they're
already
going
did it
in every unit every year.
and doing all of these inspections. I mean, they're looking at carbon monoxide, they're looking at fire, they're looking at
Exactly.
egress.
Well, maybe that will be,
So
I don't know.
our inspector needs to do is assess the number of bedrooms.
But they might
and
have to go in to see the layout and
Well, that's
all
right, yeah,
that
they might
stuff.
have to go in and spend 5 minutes to count bedrooms.
Yeah.
But, maybe she could do more than 300 if all she has to do is count bedrooms.
Mm-hmm.
Because he's doing everything else.
Well, there's certainly a good opportunity here to work this out.
Yeah,
In a way
and
that
that's what,
has some
we're not quite there
efficiency
yet.
to it.
Greg,
Yep, thank you. I just wanted to add, I think every town in the state, I guess I can't speak for them, but we were certainly a bit surprised that this was going to be
A big problem.
required level of inspection. I think it might be hitting our town and some of the, Cape and Island towns a little harder than other parts of the state that don't have as many short-term rentals. But this is going to be a very new program in a new program that we already had in health. So some of this is going to be, seeing how the sausage is made.
Yep.
Once we finally get a person in here. At bare minimum, the staff we have are not going to be able to do an extra 1,000 inspections a year.
Exactly.
The question of who's doing what and, if I'm doing this, you're doing this, some of that is going to be, hashed out once we finally get people on the ground. Hopefully we'll be able to do it the most efficiently possible.
yeah, let me ask you, Greg, but this new building inspector in the building department could be funded through other town funds, not with a short-term rental fee increase, is that correct? If it's possible.
It is possible.
Possible.
I mean, it's theoretically, anybody could be funded from various sources. I think part of the analysis was this was, not an immediate surprise, but certainly not something that's been budgeted by the town. And it's a, mandate by the state very specifically for short-term rentals. So the town could fund it through various other methods, but this is very specifically for people who own and use short-term rentals. So it seemed most appropriate kind of for that fee. And I think Judy said too, you really don't want to have two different fees from two different departments for the relatively same thing.
Right.
Yeah, but it wouldn't have to be, technically, it wouldn't have to be done with a fee. It could be done other ways. But let me ask Judy, can you envision being comfortable taking information from a building inspector in the building department that goes over to the health department and you use to run your short-term rental regulation? That seems maybe unusual.
No, I would certainly be comfortable with that. I mean, we do that, we work very closely with them every
They
day,
could
you know?
use your criteria for a bedroom. You could teach them what it is, because theirs is different.
Yeah, and if they, like I said, if we see something that we think is not right, and we will ask them to, you know, come and assess the situation and
Yes.
vice versa. So,
Well,
that happens
Sounds
still.
to me like this could be worked out through.
And that's the
SOPs.
plan. This is very early stages. We haven't quite got there. They're just like now just trying to set it up so it can go through the budget process and.
but I remember when we had the working group and we were putting together the short-term rental regulation, and John was a part of that. Initially, there was, I would say, majority opposition to it. And then we talked and made compromises and worked things out, and eventually came to the short-term rental regulation, and it passed 11-1. But one of the issues that we dealt with, and the rental fee was specifically lowered to get all these people on board,
Get
because there
buy-in.
was opposition to it. And people would say, well, you'll $50, but you're just gonna raise it next year and all this and that. So I would say if the short-term rental fee jumps way up, we're gonna be held responsible for it, that all the nuances of what you're talking about don't necessarily
This
get
is
out there.
this is a Massachusetts state mandate.
Yeah,
It's not
Yes.
the Board of Health.
We're
If they don't like it, and they
in a
don't
whole
wanna pay
different.
it, then they won't be able to do short-term
Ron.
rentals.
I take your point. It is a mandate, but the pushback will be, well, then it has to be done as efficiently as possible. I think that's the point that you were getting at. Is there a way to combine both of these things? So instead of it being $150, which is a 200% jump, maybe it's only $100, which might be a little bit more palatable. And the other thing is, I find it hard to believe that one inspector can inspect 1,000 homes a year. That's like four homes a day.
Yes.
That just seems remarkable.
Greg, can you have a comment on that? Can one building inspector inspect 1,000 homes in a year?
So theoretically, 4 a day is possible, but the logistics involved would be extremely difficult.
There's sick
Again,
days,
these
there's vacation.
regulations, the mandate from the state came out recently. I don't think they necessarily understood the level of inspections that were going to be required, especially by certified building inspectors. And just to, maybe strengthen or echo a point, it's not just Chatham. It's not just Chatham's Board of Health. This is a state mandate that went out to every town on Cape Cod, every town in Massachusetts. While people might, blame Board of Health, the town, the department, if they just do a simple search, I mean, all hands are going to be pointing to this new regulation that's not from the town.
Well,
It sounds like this regulation will be delayed or changed because of the pushback, because right now, the town can't possibly do it even if they hire one more inspector, practically speaking.
It'll
I
be-
mean, that's the fact, and our town's probably better funded than other towns.
and in any future referencing of fees, it would seem to me that in the future, it would have to be an itemized fee. In other words, it would be, the Board of Health's fee may be $150, and then under that, it would reflect, $75 for local, and 75 for state mandate. In other words, you would have to reflect in the fee postings and the annual, what really was driving the fee, the synthesis. of the
Itemize what the
fee.
fee, where it's going.
Exactly, and why, right? So
Well, I think,
somebody.
yeah, we're gonna have to have hearings on it anyway, so.
Well, yeah, that was my
be
next question.
flushed
So
out.
what is the next step, Greg, for this? This is going to town meeting for approval, or to us to approve, for approval?
No.
The fee,
Town
So really the next step is.
the hiring would go
uh,
to town meeting.
Yeah, so community development is going to bring these proposed new position to both the finance committee and the select board to get their review and potential approval to put on the town warrant to be part of our operating budget at the next town meeting. And, based on that, I think if it were to go to town meeting, we could start talking about potentially updating regulations, and then post-town meeting, that's when that would start happening.
Okay, other questions, comments? So Greg has heard everything from the Board of Health, so you can communicate all of this to the people you're talking to. You don't have to answer that.
Absolutely. Katie and I will be chatting tomorrow.
I'm just, okay.
All right.
Dick, did you have another comment?
No, it just seems excessive to do it every
Yes.
year.
Yes.
You know, once you've inspected a place, to say you have to go in, I mean, this whole thing is kind of ridiculous.
But that's the,
That's the.
And that may
unfunded
change with the
mandate.
states,
Yeah.
who knows, you
We'll
know.
have these ideas.
You're absolutely right. Somebody came up with, well, let's do annual inspections. Well, if it would be a lot more palatable and cost-effective to do every other year inspections, there's not a lot lost. You know, I mean, they could do that simple adjustment on this mandate and all of a sudden make it much less onerous on municipalities.
okay, so Greg and Judy will keep us updated, and we'll come back and let the board know about what's happening, because obviously we have a high level of interest. Thank you very much, Greg.
Thank you, Greg.
Okay. Then we have any public comments on what we've been talking about, or anything on the prior agenda? Okay, and then if not, agenda items request. We have, what we,
Well, we were talking about the testing, the IA.
Performance.
oh, yeah.
Performance,
IA,
It's
So I will-
a future agenda item for
IA testing.
information and update on the septic
Performance
system testing
standards,
and what all that means, and the data, maybe reviewing what the person from the county said.
Yep,
And
I've got
I
that.
think back at that time, we were also looking for someone that could give us a brief, sort of a science behind the septic system.
Which
The
she did.
bacteriology.
She did.
chemical-
Did
she do
that.
Yeah.
Okay, well, maybe we can review that, 'cause
Yeah.
I need it. And we've already talked about other agenda item requests. We have 32 Mill Hill, which is coming.
what is the announcement on that? What is the date and the location for that next legal step?
For
Mill Hill?
Mill Hill, tomorrow.
It's tomorrow,
Yep.
and it's at what time?
It's at 2 PM at Barnstable Superior Court.
Barnstable.
And it is open to the public, actually.
Yep.
Yep, I will be going as a member of the board, and
And what are we expected to do? What is the action?
The judge will make a determination if he's in, I don't know the legal terms, but he hasn't done
Whether
what he
he's in
was-
compliance with the
Right.
prior order?
Right, which
And
he's
that'll be,
not.
and that'll be as reported to the judge by whom? By us?
By us,
He's
yep,
supposed to make an appearance, isn't he?
yep.
And he could ask for postponement. He could say, I'm working
But are
hard,
you-
and I haven't been able to do it
All
yet.
right.
You know, again, this isn't,
yeah, we're going to put
This-
this on the agenda and discuss it, the court thing tomorrow, then we'll have the results of that, and we'll have it on the agenda, we can have a complete discussion. And
But
that's the way we're supposed
Judy,
to do it.
am I assuming that you're gonna go into that court with photographs and video and what have you? And share that with the judge to say, Your Honor, here are the current conditions on this property.
Yep.
As of today or yesterday or what have you.
Yep.
And then based upon his reaction to that, he'll then decide what he wants to do next, and then coupled with Mr.
McGrath.
McGrath's testimony about, why or why
Yep.
not,
so the next meeting, that'll be on the agenda.
tomorrow.
The results of tomorrow will be it'll be on the agenda, yep,
Okay, on
results
our
of tomorrow.
agenda, but tomorrow, we will know
yeah.
Yep, and
what
we'll have it-
happens in court.
Yep.
Yes,
And I
it'll be on
can,
the next
I can
agenda
let
item.
you know that as well.
Any-
'Cause
any
it's all
other-
public, it'll be public knowledge, but.
Any other topics for, any other separate agenda items? I have one, we had talked about the airport, follow up on our discussion of lead in aviation fuel.
Yep. That's still on, our,
And
The
there
transfer
were certain
station.
things said there, we can follow up on that. And the other is the transfer station tipping building floor condition with odor complaints in the summer. What's the follow-up on that? Okay, and that'll be dates to come. Okay, other agenda items? Okay, so we have minutes of January 27th for review. Any changes? And they were just two variances there. If not, can I get a motion to approve the minutes of January 27th?
I will so move.
And a se- Okay, all in favor, say aye.
Aye.
Opposed? Okay, so the minutes of January 27th are approved. And then, can I get a motion to adjourn the meeting?
So move.
Second.
And we can take a voice vote. All in favor of adjourning the meeting, say aye.
Aye.
Opposed? Okay, the meeting is adjourned. We'll shut off our mics.